Hi, I'm Fran Holderthay, and for those of you that don't know me, I'm a salary GP from Bourton Health Centre. Just want to take a few minutes of your time just to talk to you about the Active Practice Charter. For those of you that don't know already, it's an initiative that's been brought in by the Royal College of General Practitioners and Sports England, and it's basically aimed at trying to increase the physical activity of both practice staff and patients. I don't know about you guys, but I'm always quite shocked about how poor my physical activity is on the days that I'm working. I wear one of these fancy Apple Watch things, and although I don't know fully how to use it, I have noticed that during the days I'm working, my step count in particular is significantly lower than on the days I don't work, and I'm not a gym bunny or a particularly sporty or active person on my days off. But I do significantly more on my days off, which suggests that my job is very, very inactive and sedentary, which, as we all know, isn't good for our health. So basically, I feel that I personally need to increase my physical activity both at work, but also I feel that when I'm speaking to patients, I also need to bring in promotion of physical activity into my clinical practice. And I feel this is something that potentially we could all be doing, regardless of our role within the clinical setting. We will be talking to you in the coming weeks about ways that we can do this. We've got all sorts of suggestions. Some things are very simple. Simply things like, rather than using the call-in screen to get patients from the waiting room, going to collect them by foot, rather than communicating by screen message on our computers, getting up and going to speaking to a colleague. And it's starting from simple things like that to even trying to kind of come together, a weekends perhaps with practice part runs, cycling schemes, and there's all sorts of things, but we're very conscious of making sure that it's aimed at everyone and suiting a wide range of needs. And together with that, we then want to progress from promoting it within practice staff to then trying to promote physical activity to our patients as well. But we felt it's better to kind of practice what we preach and start with staff first. And I think there's a particular need, particularly when things are so busy at the moment, and we're probably not concentrating on our physical and mental well-being. So I think it's really important that we're looking after ourselves, and I'd really like us to take this forward. Like I say, we will be getting in contact with you in coming weeks and months about ways that we can do this. But for now, what we wanted is just to get an understanding of where people are currently at in terms of their physical activity, both in and out of work, but also how knowledgeable and confident people feel in terms of trying to promote increasing physical activity to patients. I know myself that, given the short time that we get with patients, I do try and promote physical activity, but I have to hold my hands up and say that I don't go into enough detail probably, or make enough suggestions about how patients can actually increase physical activity. And I, for one, would really like to learn more about how I can do that. But like I said, we're going to be sending out a questionnaire, and it's basically aimed at trying to get an understanding of what your current levels of physical activity are and what your levels of confidence are in terms of promoting it to patients. Now, I know that you get a lot of emails, and I know a lot of them are questionnaires. I do apologise for that, but please, can I ask you to just spend 5 minutes of your time filling in this questionnaire, because it would be really, really, really beneficial for us to get a better understanding, to try and make sure that we're successful in implementing this Active Practice Charter. I really do feel that it's something that could really benefit us all, both practice staff and patients alike. So if you wouldn't mind just filling in the questionnaire, I'd be really, really grateful. Thank you very much for your time. Take care.